Now, the UK government is set to reveal a new plan to stop the expansion of COVID-19. Numbers have surged, particularly in northern England, in cities such as Liverpool, Manchester and Sheffield. Downing Street saying the country is at a critical juncture in managing the virus. So this as Prime Minister Boris Johnson prepares to outline a new three-tier alert system for England at a press conference later today. For more, I'm joined in the studio by our International Affairs Editor, Armen Georgian. Armen, what is the three-tier lockdown that Boris Johnson is expected to announce?
Well, the Tier 1 is actually the status quo for those areas that don't change. So it's essentially following the rule of 6 and maintaining social distancing. So that's Tier 1. You can see at the bottom of our graphic, that's essentially what is already in place. Tier 2 is no mixing of households. Yeah, let's have that in maybe bigger because it's hard to read otherwise. Got no household mixing in homes, gardens, or in a hospitality setting. So that means you could still meet another household outside somewhere in a park or on the street. Then Tier 3 is the strictest one. No social mixing at all. So pubs, restaurants, leisure facilities closed, and you can also not meet anyone outside your own household. So that is the strictest tier that we're expected to be announced.
So will these measures actually make a difference?
Well, it's already been, it's caused ructions between the central government and local authorities, some of the latter saying we haven't been properly consulted. This echoes actually what in France local authorities said a couple of weeks ago. We were given in some cases half an hour's notice by phone call. Maybe it's not quite that bad, but certainly local authorities, some of them were not happy with how this was handled. Just to play you quickly, quote you a tweet from the mayor of Liverpool, Joe Anderson. He said this a little earlier this morning. Let's be clear that having ignored my pleas for over a month, the government now blame us and impose lockdown by diktat without a full financial package and support for businesses. We are levelling down, not levelling up. We will continue to stand up for our local businesses. And in the northeast, some local authorities there have been saying we're really worried about the fact that these rules have changed 3 times in the last week or so. And so people are just going to get very confused and might actually disengage slowly from cooperating with the measures. So that's one of the worries there.
Now, Britain already has the highest death toll of any European country. So is it effectively losing control of the virus?
Well, this is what the Deputy Chief Medical Officer of the UK is warning, that the UK is at a tipping point. If things go on the way they are, then there's a risk that intensive care will be overwhelmed again because, of course, it's not just about reaching 100% of capacity for COVID patients. You have to leave room for other patients as well. This is the key thing. This is obviously the problem France is facing now as well. In fact, if you get up to half of intensive care beds all being used just for COVID, that's already considered saturation because you have to leave the other 50% for other cases, other urgent medical procedures. So that is what the medical officials are worried about. But what in terms of the general public's reaction, Annette, as we all know from friends and family in the UK, a lot of people are complaining about this tracing system being barely functional. So at the moment, it's estimated to reach only a quarter of those that it's supposed to. So if somebody's been infected, only a quarter of the contacts are actually being reached. So obviously, when you ask people to make these sacrifices, inevitably some of them are going to say, well, why are we going to make more sacrifices when the government can't actually get this contact tracing system right?
Armen Georgian, thank you for that.